I'm Michelle Neske, the Posh PA, and I'm going to talk to you today about what happens after you graduate PA school. I talk a lot about tips on how to get you into PA school, but you finish the program, now what? Do you need to obtain certification? Do you need state licensure? What do you have to do to be able to go out and practice as a PA? I'm going to break that down for you in just a second. But if you haven't already, smash this subscribe button. I'm here every week dropping new videos to help you get into PA school, become a successful student, and a fulfilled practicing PA. Now, if you've ever encountered a PA in the healthcare setting, you may notice something on their white coat or on their badge. It says PA-C, okay? That C stands for certified. Now, after you graduate from an ARC PA accredited PA program, which most are, you are required to take a national certification exam referred to as your boards, right? That is called the Physician Assistant National Certifying Exam, or better known as the PANCE, okay? Not the pants you wear, PANCE, Physician Assistant National Certifying Exam. This is what will get you that C on your badge or on your white coat to say that you are a nationally certified PA. That means you are certified to practice in any state that you choose in the United States. Now, you're going to be preparing for this exam throughout most of your PA education with end of rotation exams and really getting you ready, even with preparatory exams called the PACRAT, which kind of simulate the PANCE itself to really get you there, okay? So not to worry, there are great study resources and preparation tools for this exam. Now, the exam itself is 5 hours long. It is 300 multiplication questions administered over 60-minute blocks, all right? So you will register to take this exam at some point after you graduate from your PA program, and I'll be doing a separate video on how to breaking down really the PANCE itself into different sections and how to appropriately study for the exam. But today I just want to talk to you more about the steps you need to take to go out and be a practicing PA. So that's step number 1. Take your PANCE, okay? So when you graduate from your PA program, you're gonna go ahead and register for the exam. You cannot register more than 90 days in advance for the exam. And my advice is to take it pretty soon after you graduate, as all of that information is gonna be fresh in your head. Now, once you go ahead and take this exam, you'll be notified if you pass just within a couple of days. And once you have passed, you will get a certification number. You do not have to recertify for 10 years, which is actually amazing. But you will have to take a recertification exam every 10 years to maintain an active certification. So that's step number 1, is really to take your boards and pass so that you can become a nationally certified PA and get that C after your name. It doesn't stop there though. Once you're looking for employment, okay, you're going to be looking in different areas of the country. Each state has different licensure requirements for PAs. You are going to be required to get a state license to practice in the state of your choice. So that often includes an application where you have to provide information, including your degree and your certification number and a fee to be able to obtain your license in the state that you want to practice. Some states actually require a small exam that you have to pass on the laws regarding PAs in that state before they will grant you your state license. Now, that is not every state, just select states across the country. But in order to be able to be employed and practice, you not only need your national certification, you do need a state license, okay? So I am here in South Carolina and I have a South Carolina PA license that renews every 1 to 2 years, depending on the state that you're in, okay? That typically requires a fee, and your employers usually will compensate that fee. So that's step number 2, state licensure. Then you will need to obtain your prescriptive authority. So prescriptive authority is the ability to write prescriptions for medications. This is going to look a little different in each state as well, based on the laws and scope of practice in your state. So some states will require a prescriptive authority license. Here in South Carolina, DHEC requires you to have a license to be able to write prescriptions, okay? And that is true in most states across the country, that they're gonna require you to have a license to be able to write prescriptions. This is typically just a fee. You provide your state license, you provide your certification, you fill out an application, you put your employer, and then they will grant you a prescriptive license. You will also have to obtain a DEA license, right? So a Drug Enforcement Administrative license. That is going to be kind of nationwide, okay? You're going to need to get that to be able to write prescriptions, particularly if you're writing for controlled substances like opiates. So if your state allows that, then you will have to get EA license regardless, but you'll have the prescriptive authority and your DEA license. Once you have all of that, you will need to get credentialed based on where you are being employed. If you are being employed in a hospital or an academic medical center, you will be required to get privileges, which requires credentialing. So in order to be able to work in the hospital, each person will go through a credentialing committee evaluation and you will be approved to practice. All right. This is typically a very large application that you will have to fill out, which includes your education history, your license, all of this information in the packet. You may even be required to have evaluators in that credentialing process to be able to vouch for you and your practice and your professionalism, to be able to obtain credentials to practice inside a hospital. Each hospital's credentialing committee is different. So the requirements look a little different. The scope of work looks a little bit different. So it really depends on your employer setting. If you're in a private practice office, you may not need to do that. If at any time you are going to go to a hospital, however, you will need to get credentialed at that hospital. So just a little additional fact to know, when you are looking for jobs, you need to take into consideration the amount of time it is going to take to obtain all of these things, right? So number one, your certification. You have control over when you schedule your board exam. You can't schedule more than 90 days out of your graduation date. So I would plan to take it within the first 90 days after graduation. So you have control over that one. The state licensure and the credentialing, you really don't have control over how long that takes. And I will say, from a state licensure and prescriptive authority standpoint, about 8 weeks is the average, sometimes more. Now, there are some instances where states will offer you a temporary license so that you can get started at your job in some states. So that's important to look into as well. But I would allow at least 8 to 12 weeks for that state licensure and prescriptive authority and DEA to kind of come through. Credentialing, if you're going to be working at a hospital, also takes about 2 to 3 months minimum, okay? So it depends how often those credentialing committees meet to be able to approve your application. So some things really important to take into consider when you're looking at timeline and when you start to look for jobs in your second year, towards the end of your second year of a PA program, and you're getting closer to graduation. Just know that there is going to be a time lag between the time you graduate and the time you start practicing, because you need to obtain these things in order to practice. All right. So number one, your national certification exam, the PANCE, you definitely need to take that and you need to pass it. I will break down more specifically the components of the PANCE in a different video. All right. So that's number one. Number two, state licensure as well as prescriptive authority. And then if necessary, number three is hospital credentialing. So really think about, when you're looking for jobs upon graduation, when you might want to start, what specialty you're looking at, if it's going to require credentialing, what it takes to get a license in each state. It's easy to look up what the requirements are. Every state medical board will have a website which will detail exactly what you need to be able to apply for a PA license in that state. So be sure, if you're in whatever state you're in, whether it's Pennsylvania, Texas, California, South Carolina, I go to the South Carolina Medical Board and look up the requirements for what is needed to get a PA license in South Carolina or whatever state. It will give you a detailed breakdown on what you need to do, and then you can get a good idea of how much you really need to put in to be able to get that done in a timely manner. So check those websites out sooner rather than later if you know where you're going to practice, even if you've obtained employment, so you can get that process rolling. All right. So that's really important to know. And then lastly is credentialing. If that applies to you, depending on your employer setting, just know that that's going to be additional paperwork and time as well. I hope this video clarified for you what it is that you need to do after you graduate PA school to go out and be a practicing PA. Be sure to look for my video on breaking down the boards coming up soon.